Hello, we are Group 17 and we are going to be presenting on Activa Presto, which is a new universal composite. My name is Lauren.
I'm Shannon.
My name is Cam.
And I'm Jenny.
And my name is Julian.
We will be discussing its major uses and properties, the significance of the manufacturer's claim, important factors on proper use, competitive products, and our personal recommendation on the product. To begin, I will talk about the major uses and properties of Activa Presto. Activa Presto is a tooth-colored dental filling material that is a universal stackable composite which can be used for a variety of cavity fillings and restorations. Activa Presto is the latest advancement in this product family. Activa Presto is a light cure composite designed to mimic the properties of natural teeth as it supports biomineralization, the natural process which helps regulate the chemistry of the tooth and promotes oral health. The composite contains two unique resins that work together to mimic natural dentition. The first is mineral-enriched moisture ionic resin, which facilitates the diffusion of bioavailable calcium, phosphate, and fluoride ions. The other unique property is rubberized resin, which absorbs stress, resisting wear, fracturing, and chipping. It is just as effective even in the thin areas on bevel margins. The two resins work together to penetrate and integrate with tooth structure for margin-free adaptation. Activa Presto is strong, durable, wear, and fracture resistant, making it a great material for load-bearing applications, as well as versatile and aesthetic, making it an ideal replacement material for all classes of cavities and all restorative applications. Its stackable and shapeable viscosity allows for conservative dentistry. Activa Presto comes in a variety of shade matching and blending for multi-surface restorations while delivering essential minerals. These unique properties make Activa Presto a superior composite material.
Okay, next slide. So Activa Presto has several features that are very important for both the dentist and the patient. So first is that Activa Presto is stronger, tougher, and more fracture and wear resistant than similar products in the market. As stated before, it's due to the rubberized resin. And also Activa Presto has a significantly greater deflection at break compared to other composites, shown by the little graph in the corner. And deflection at break is an indicator of toughness and fracture resistance. So this is a very significant advantage for the patient. It's very capable of enduring harder stresses and more wear, which means less complications. However, there doesn't seem to be any significant difference between Presto and its competitors in terms of volume wear and flexural stress, which is something to take into consideration. The second point is that Activa Presto has an easier method of dispensing product compared to similar resins, and this is important for the dentist. So Presto uses a syringe instead of a composite gun, which allows for more accurate dispensing. However, this is a subjective feature. It is also a hydrophilic resin, meaning it's water tolerable and you don't need a completely dry field to work with, which can be a major inconvenience otherwise. However, it's important to note that hydrophilic resins have been criticized for lowering bond strengths, so the significance of how good hydrophilicity is still unclear. Also, it's an easily stackable resin, which is claimed to hold the shape as it's being dispensed, which can be advantageous for the dentist, and it can make a more aesthetic result. However, the downside is that it has to be cured in small increments, which can be seen as inconvenient for some people. So again, the significance of easy dispensing can be subjective, and it depends on the preferences of the dentist when it comes to the dispensing of a syringe versus a composite gun, as well as the stackability of the resin. Next slide. The last standout feature is its ability to release calcium phosphate and fluoride ions. You'll see on a later slide the graph of this feature. So as an overview, it's been shown that this resin has a continuous release of ions, and this combined with its hydrophilic properties facilitates ion exchange between saliva and teeth, and also regulates changes in the pH of the oral environment. So from a patient standpoint, this helps integrate the resin to the minerals of the tooth, seals against microleakages, and protects enamel from pH changes and caries. So this is a very significant advantage for the patient's long-term oral health.
Next, we'll talk about the important factors on use. Next slide, please. So Activa Presto is recommended for use as a filling material for pits, root surface cavities, and class 1, 2, 3, 4, and 5 restorations with no pulpal involvement. And on the right, you can see the two images showing an example of a class 2 prep and also a class 5 prep. So the directions for use are as follows. So you start by isolating and preparing the tooth for restoration. This includes beveling and rounding off the enamel margins. For class 5 lesions, however, you bevel or undercut the enamel. Next, you place the appropriate pulp protection if it's indicated, followed by etch and apply bonding agent based on the appropriate manufacturer's instruction for use. And this is where Activa Presto comes in next in the step. And it acts as a dentin and enamel replacement material. And to use Activa Presto, you use and place a 19 gauge applicator tip, as seen in the image at the bottom right, and applied in 2 millimeter increments and with light curing for 20 seconds between each layer. And then lastly, you finish and polish the restoration as usual. Next slide, please. Now we'll discuss about storage and handling of Activa Presto. So it's stored tightly sealed in an original container at cool temperature. You want to avoid direct light, extreme temperatures, contamination, and sources of ignition. The shelf life of Activa Presto, if it's unopened, is 2 years from the date of manufacture. And when used in clinic, it has to be recapped immediately after use. And cautions that come along with Activa Presto: the uncured material may cause eye or skin irritation on contact, hence why dental professionals should wear safety glasses and surgical gloves when handling and do not exceed the manufacturer's recommended curing time for the light, which is 20 seconds.
Okay, now we'll discuss one competing composite materials of Activa Presto. Next slide, please. So we have chosen a Filtek Supreme Ultra flowable syringe made by company 3M as a competing product. This product, as shown in the picture on the left, on the upper left, is the identical syringe type composite as our chosen product, Activa Presto. We chose this 3M Filtek as a competing product of Activa Presto because of their similarity in usage purposes and their ease of applications as listed. However, the main difference between them is their composition. Unlike Activa Presto, which does not have bis-GMA, bisphenol A, nor BPA derivatives, 3M Filtek is a nanocomposite flowable, as you can see on the lower left picture, containing some of these materials as listed. Next slide, please. Here on this table, I have summarized and compared some of the significant properties that can be used in considering one product over the other. I have highlighted in red the properties when one was found to be more superior. I want to point out some of the important factors that Activa Presto stands out in compared to the 3M Filtek, starting from the compressive strength. We learned that compressive strength and diametral tensile strengths are important factors to consider for chewing forces. And considering the standard deviation, the compressive strength between them, as you can see, are similar. However, Activa Presto was found to have a slightly lower shrinkage as well as higher radiopacity. Radiopacity, we know, can be very useful in monitoring the restoration integrity, as dentists rely heavily on dental radiographs when making possible treatment plans for our patients. The bottom two characteristics are, I think, what makes the Activa Presto a significant composite materials. First, the unique character of the Activa Presto is that they are moisture tolerant. And this does not necessarily mean that Activa Presto can be used during saliva-heavy oral condition, but considering the humidity of the patient's mouth while they breathe and some of the moistures on the prep tooth during the dental procedure, Activa Presto indeed stands out from other composite materials, which requires total isolations of saliva during its application. And although 3M Filtek as a nanocomposite to release and recharge calcium, fluoride, and phosphate ions, release of these ions were more significantly found in Activa Presto, which I will discuss further on the next slide. Next slide, please. So Shannon earlier has explained the significant amounts of calcium, fluoride, and phosphate ions released from Activa Presto, but I want to go ahead and reiterate that information by showing this graph and point out and compare the two lines. As listed in the key, the yellow line represents 3M Filtek and the dark blue line represents Activa Presto. And by comparison, it is clear that ions released from Activa Presto is much higher than that of 3M Filtek. And this could indicate that Activa Presto, by releasing these ions, can help in inhibiting the growth of microbacteria and also the buildup of plaques, as well as initiating the remineralization process in early cavity area. Next slide, please.
Finally, our group would like to recommend a specific composite. Based on our findings, we can concisely state that Activa Presto is a game changer in the world of dentistry. The product retains many of the favorable attributes found in commonly used composites such as high tensile and compressive strength, color vibrance, and flowability. However, also further improves on other notable attributes such as radio opacity, bioactivity, and moisture tolerance. Additionally, despite having all these benefits over the competition, Activa Presto does not contain bis-GMA, bisphenol A, and BPA derivatives that caters to patients that are sensitive to these ingredients. If you are looking to take your dental practice to the next level, Activa Presto is a stepping stone to that reality. Thank you all for listening.